This is INside Urology, Cutting to the Chase, a podcast from the Indiana University School of Medicine Department of Urology. We talk about all things urology with Dr. Clint Carey. Each episode features conversations with physicians, researchers, patients, and we'll share some of the stories shaping the field. So let's cut right to the chase. Welcome in to INside Urology, Cutting to the Chase, episode 7. I'm here with Dr. Clint Carey, the chair of our department, and we have as our guest today Dr. Rosalia Misseri, the Pediatric Urology Division Chief. Welcome to the podcast.
Thank you for having me.
Just give us a brief description of your title here and kind of what drew you into the field of pediatrics.
I serve as the Chief of Pediatric Urology at Riley, and it's a group of 10 pediatric urologists that cover the spectrum from prenatal urology until transitional urology, which is when kids become adults.
And what drew you into the field? Why kids?
Well, I realized during my residency that I liked putting things together more than I liked taking things apart. And so I naturally gravitated to a reconstructive field. Back when I trained, there were very few reconstructive urologists and reconstructive urology fellowships. And I realized that a lot of pediatric urology was reconstruction. And so I was drawn to that aspect of urology and have loved it ever since.
So you're the head of pediatric urology here at Riley, and you've been doing that for how long now?
About to start my 7th year.
Okay. And you've been here with us for how long?
It'll be 20 years on August 5th.
Oh, wow.
Wow.
Does that include your fellowship or just faculty time?
No, just faculty time. So I was here as a fellow from 2002 to 2004, and then I left for a brief period and went back to New York and realized I really missed working in a world-class pediatric hospital. And so a job opened up, and I came back and been here for the last 20 years.
Can you tell us just an average day on the job, what your day looks like, and the patients that you see, and some of the conditions that you normally treat?
So, every day starts about 7, and the whole day is full of things to do, regardless of whether it's a clinic day or an OR day. It varies. Some days you'll see adolescents, and some days you're seeing newborns. On some days, you're actually working with the maternal fetal medicine doctors and seeing pregnant women and talking about any abnormalities that were noted in the baby's kidneys or bladders prenatally. So in the course of the day, I'm probably taking care of kids from, prenatal to about 18 or so. And for a long time, have taken care of a lot of adults. So when I came back to Indiana, one of my real interest was seeing what happened when kids got older. How did what we did at age, 3 or 4 or 7, what did that look like when they were 20 or 30? And so I've had the opportunity to build an internationally recognized clinic for young adults with congenital urologic conditions. And that's been kind of one of my passions, in addition to taking care of kids, is really seeing them through and seeing what happens. And when you're at a place for 20 years, you actually do follow these kids and see them graduate from high school and start college and things like that. So it's been very, very gratifying to see really kind of what you do as, when you meet somebody as a child, what it means through adolescence and young adulthood. So that's been really a special part of my practice.
You've said you've treated, a lot of adults as well. What's some of the biggest differences, between caring for adults versus children?
Children have somebody who's actually looking out for them and making sure that things get done, as opposed to adults who may or may not do what they want because they have their own free will to do what they like. it's interesting to see how during adolescence, regardless of what your urologic condition is, how you rebel against your parents, whether you're, you have intellectual disabilities or you're neurodivergent. It's the same as any other kid. They are not going to do what their parents tell them when they hit those ages. So it takes a little special care around that time to make sure that they're doing what they need to do to stay healthy.
I think you're in charge right now of one of the top ranked pediatric programs in the country, pediatric urology programs in the country. Obviously, we're proud of that. I'm sure you're proud of that. Talk to us a little bit about how do you think we got here? Maybe some of the history. You could go way back to talk about some of the things that even Mike Mitchell and some of those folks did.
I think it starts even before that. Dr. Garrett, who was the chair of the department, actually had an interest in pediatric urology and wrote some seminal papers in pediatric urology. So at that point, probably until 1951, pediatric urology wasn't considered a specialty. So it was either adult urologists doing it or pediatric surgeons doing it. And about that time is when people became really focused on, kids are not little adults and things like that. And so it started to become recognized as a true field. After Dr. Garrett, Mike Mitchell was the chief of pediatric urology and was a very innovative surgeon who did a lot for kids with spina bifida and neurogenic bladders where the bladder doesn't work normally, often related to something wrong with their spinal cord. And so he kind of made a disease that could be very detrimental to the kidneys, a more treatable disease. So, along the progression, we've had people live longer with their own kidneys functioning well for them without the need for renal replacement therapy, so dialysis or transplants and things like that. And subsequent to that, Dr. Rink took over, who kind of took everything that the people before him did and augmented that and made it better and started attracting people from across the country. And initially when he started, I think Mike Mitchell retired soon after, or left Riley soon after he started. So he essentially built the practice up to 5 pediatric urologists and then really kind of revolutionized the way we treat some congenital anomalies. So I'm extremely lucky to have trained with a lot of people who now work with me and who I work with. It's an interesting family where people leave and they come back again. So we really have made enormous contributions to the field of urology, and we continue to, which is something that I'm exceedingly proud of.
Yeah, I think one of the things that maybe a lot of people don't know is, the Indiana Pouch obviously started here at Indiana University, but that was, from my understanding, really a collaboration between some of the pediatric urologists, Mike Mitchell, and some of the adult urologists, whether it was Randy Rowland or Rick Burrell, and a combination of them. So there's been some really big things. You guys have one of the larger bladder augmentation databases for spina bifida and neurogenic bladders, and a lot of really cool, innovative things you can do research with.
Yeah, we have, one thing that we don't have is a lot of other pediatric urologists in the state. And so we have this enormous expertise in all of the common pediatric urologic diseases, whether it be posterior urethral valves, whether it's bladder exstrophy. So we can actually tap into all kinds of databases that we've created and kept prospectively over time, and really look to answer questions that are important for people as they take care of kids. And we're also able to see the evolution of what's happened over the years. So it's very impressive, the volume of experience and data that we have to kind of look forward and kind of tweak things so that we can make things better and more successful for people.
I think it's your guys' model is a pretty innovative model for caring for the state. Obviously, like you said, you're the only pediatric urology group in the state, and that the way you guys have set up the model allows you to take care of the state. Everybody doesn't have to come here down to the big children's hospital. You guys actually branch out and go to sites all around the state, and that helps take care of all the problems in pediatric urology around the state. But it also makes the job interesting because you take care of a lot of the bread and butter pediatric urology things, but it allows you to also take care of some of the things you just talked about, like some of the very high level, more academic urology focused diseases that are much more subspecialized. So you really do cover the whole spectrum of pediatric urology.
Yeah, we really do. And we have 16 satellite clinics. So over the years, this hub and spoke model has been created, and it's actually worked really well, and families seem very grateful that we meet them where they are. Obviously, everybody's come to learn that if there is something that's complicated or any special testing that's needed, they'll come this way. But it really feels like we're doing a great service to people, especially when gas is $6 a gallon.
Since you treat children, you're really treating kind of the whole family and educating the whole family. Can you talk about just how you approach conversations with parents and families?
So I think you really need to meet the families where they are. Some families come in and they've done all the research. They've been on all the platforms, and they have an understanding of what's happening. And some families come in and they want to learn from the expert. And so you really have to meet them where they are. Some families are extremely anxious and worried about their children, and some people are not. And so it really depends on what the family is like and how you approach them. At the end of the visit, the goal really is to make sure that they understand the disease, the treatment, and the importance of taking care of things. I think the biggest lesson that you learn, and you don't learn it immediately, is how to gauge what the anxiety level is and what people are truly worried about or not worried about, and what does silence mean, and what does talking a lot mean, because sometimes silence means I'm really scared, and sometimes it means I'm not interested in what you have to say. But
you've talked about, kind of being able to see the patient from when they're young to, to when they're older. Can you talk about maybe some moments with a patient that you treated when they were young and then heard, continue to hear from as they get older?
Quite a few. So, I've gotten wedding pictures now, which makes me feel really old. But probably most memorable is, last week I saw a patient that I took care of from the day he was born, and he's 18 now, and he said, I really want to give you a hug because you never gave up on taking care of me. And he's given up on taking care of himself at some points, but I mean that's pretty moving,
Yeah.
And unfortunately, the ones that you have the longest relationships with are the ones who have the most severe diseases, and so sometimes working through all of the things that go along with medical trauma and, and why do I look different than somebody else, or why do I pee differently than somebody else? Those are all things that as we're working through them, we don't necessarily think of, but at a certain point it dawns on them that there is something different, and how do we work through that? I get lots of prom pictures, lots of texts from moms. What am I supposed to do? So
let's talk a little bit about the fellowship you guys have. Being at one of the best centers, I think we're both biased, but probably have one of the better pediatric urology fellowships in the country. You were a fellow here once. Tell us a little bit about it, maybe how it was then, how you think it's changed, and just your overall view of it.
So I really think that the fellowship has only gotten better, because now instead of learning from 5 people, you learn from 10 people. The interesting part of our fellowship is that there are set limits of, how many surgeries do you need to do in this category or that category. And usually by about the 4th month of a 2-year fellowship, they've done all of those cases, which means that you just have that much more time to perfect what you're doing. And so I don't think that there's a fellow who's ever finished here who doesn't feel confident leaving the program and going places to start new programs. So several of the division chiefs across the country are graduates of our program now. Several have, been presidents of societies and things like that. So we really get a good foundation, not only for the technical aspects of pediatric urology, but also leadership positions, so that they can train other pediatric urologists. Currently there's a big dilemma about people going into fellowship because it is an extra 2 years of your life, and most people finish doing their urology residencies when they're in their early 30s. And so training attracting people to train in pediatric urology has become increasingly more difficult. And there are about 29 fellowship programs, and many of them don't match, so they don't have somebody to take that fellowship. And we've been very fortunate where we match usually our top choice year after year. So that's really a testament to how good our program is, and how we prepare people to get out there and do all aspects of pediatric urology, from the simplest surgery to the most complex reconstruction to the most complex robotic surgeries. So it really, we have the whole spectrum covered.
Do you have any advice for anyone wanting to get into this field of pediatrics?
I think first and foremost, you have to love what you do. And so, Dr. Carey obviously didn't like it. So,
our quick sidebar. So I obviously did my residency here, and during my residency, we went through some transitions. I think when I was a 3rd or 4th year, we transitioned from 3 residents a year to 4 residents a year, and then we changed from a 6-year program to a 5-year program. I still had to do 6. And so because of these changes, we had to change some of the rotations. And so I did and had to come back and do some rotations at Riley as a resident. More so, I think my class did more pediatric urology time than any other class before them, and probably any other time since them. So I was only about 3 or 6 months away from doing a full 2 years of pediatric urology. And yes, I chose to do oncology.
So he liked taking things out rather than putting things together.
That's right.
So.
Obviously, you've been around the program for a long time. You know a lot of the history about the program. If you could summarize some things, what are you most proud of about Riley and pediatric urology here at IU?
I think everybody sees the job as an opportunity to help kids, but also the responsibility of taking care of somebody's most treasured thing, right? Is their child. And I think all of us have that perspective. So every time we go into a room, that's what we're thinking. This is somebody's child, and I've got to do my very best. I think the importance of knowing who you're taking care of and why you want to be, as meticulous and as perfect as possible. There's no cutting corners in medicine, but it's just the way everybody gets treated. Many people come and, they're like, oh my God, you guys get along so well. You get along so well. And it's, I can't imagine working in a place where you don't get along so well, because it's, that's the way you kind of go forward.
Your answer about talking that part about meticulous and being very intentional, that's really true. It makes me think, I still remember learning a lot of surgical technique, and the time, we spent a lot of time in pediatric urology, and you guys do, me having trained here as a resident, I remember learning a lot of surgical technique and paying attention to details, how to engage the tissue with your needle, what angles and things like that. All the stuff that you guys teach the residents and still teach them to this day is a big part of the training of this program. So, even though I went to drag my knuckles in oncology, I still remember those surgical principles. So you do a very good job for the program.
Do you have any funny things that kids have said to you over the years that have stuck with you, or any funny questions they've asked? Or
I think some funny things have happened at the airport. So there's that window at the airport where you can watch people kind of walk as they're going out. And one day there's like this loud thumping on the window, and I look up and there's a kid, and he has his shirt up and he's pointing to his belly and he's doing the thumbs up sign to show me that. I asked one kid if he had any pets, and he looked at his dad and his eyes were really big, and the dad says, well, tell her. And he says, I have chickens. I said, how many chickens do you have? And he looks at his dad and he goes, a lot, right, Dad? And the dad goes, we have 40,000 chickens.
oh my gosh.
So that they're awfully cute. Sometimes they try to guess my age.
I'm sure
that's either a really good day.
It's
or
really
bad
good
day.
or really bad. Yeah. So, so they're kind of funny. And like today, I was talking to a kid about a pretty big surgery he was going to have, and all he wanted to know was, where do I put my laptop when I'm in the bed? So we talked about how they have trays, and you could put your food on there, but you also could put your laptop on there. So it's interesting what they're worried about.
Yeah.
If you weren't a pediatric urologist, what would you be doing?
It's kind of hard once you're 30 years in, right? You've finished medical school and then started your residency. I would like to do something creative. I don't know. Maybe I'd be an interior decorator, or, learn how to blow glass or something like that.
Still working with your hands.
Yeah, I'd like to work with my hands.
Yeah.
Kind of like seeing how things end up in the end, right?
Yeah.
How pretty does it look, or how nice does it look? And
What about outside of work? What do you like to do? Favorite movie, favorite show, hobby?
I love watching TV.
What's your favorite show, movie?
Gosh, I don't know. I haven't been to the movies in a long time. The bed bugs kind of freaked me out a little bit. I'll just watch anything on TV.
Anything. Just turn it on. Doesn't matter what it is.
Yeah.
You guys do Netflix, stream stuff, Hulu, YouTube?
Yeah, Netflix.
Netflix.
Yeah. Hulu, YouTube, Paramount,
I know.
Apple TV.
I know. Yeah, everybody quit cable because it was so expensive. Now we're all paying probably more with all our streaming services.
No, I do. We really like traveling. the nice thing about Indy is there's an airport that's really easy to get in and out of. So
Yeah.
Thank you so much.
Yeah, this was
it's
fun.
great, fun.
Yeah. Thank you.
Thanks.
Thanks for joining us on this episode of INside Urology. Make sure to follow, subscribe, and share this episode with someone who might like an inside look at the world of urology. And stay tuned as we keep cutting to the chase.